Mr. Smith, it's nice to meet you. My name is Erika O'Brien, and I'm a registered nurse, and I'm working on my graduate degree to obtain my nurse practitioner, and I will be the one working with you today. Have you worked with a nurse practitioner in the past?
No.
Okay, great. I am currently studying to be an acute care nurse practitioner. Nurse practitioners work independently to manage health care and to help you achieve optimal health. We work with patients to diagnose, order tests, write prescriptions, and place referrals as needed. Okay, Mr. Smith, to get started, how would you like me to formally address you?
Mr. Smith is fine.
Okay. As a part of your health history today, I'll be asking you some personal questions, and I just wanted to let you know that all of this information will be kept confidential unless you are a harm to yourself or to others. Would this be okay with you?
Yes.
Okay. And I will also be taking brief notes. Is that also all right?
Yes.
Okay. To begin, can you give me your name, your full name?
Robert Smith.
And your birthday.
11/12/86.
Mr. Smith, what brings you in today?
Just a health checkup.
Okay. And when was your last examination?
2 years ago.
Okay. Do you have any medical history, including chronic or mental health concerns?
No.
Okay. Now to begin with your past medical history, do you have any concerns related to your current state of health?
I have heartburn.
Okay. Are you current on your immunizations?
No.
Okay. When was your last tetanus shot? Do you know?
Probably 4 or 5 years ago.
Okay. Have you ever had a TB test?
I have not.
Okay. Have you gotten the flu vaccine this year?
No.
Okay. After this appointment, we'll be able to get you set up with that, okay?
Mm-hmm.
Have you ever had the hepatitis B vaccine?
I have not. I know.
Have you ever had any exposures to communicable diseases, which is like TB or hepatitis B?
No.
Do you have any allergies to any medications, any food, or environmental factors?
Not that I'm aware of.
Okay. No allergy to penicillin or latex?
No.
Have you ever been hospitalized or had any surgeries?
No.
And any emergency room visits?
No.
Have you ever had any accidents, injuries, or harmful ingestions?
No.
Do you take any medications on a regular as needed basis?
I take something for my heartburn. I can't remember the name of it now.
Okay. Maybe you could bring that in for your next appointment.
Sure.
Okay. Do you take any vitamins or herbal supplements?
No.
Do you use any sort of complementary or alternative therapy such as acupuncture, chiropractic care, spiritual care, any special diets or vitamin therapy?
I do not.
So let's discuss your family history. In any of your immediate family members, which would include your parents, your aunts, uncles, grandparents, or children, do you know of anybody that has asthma?
No.
Any allergies?
No.
High blood pressure?
Yes.
Mhm.
Father had high blood pressure.
Is he deceased?
He is.
And what was his cause of death?
Heart attack.
Okay. Any heart disease other than your father? Any stroke or neurological concerns such as seizure disorders?
No.
Diabetes?
Yes. Mother and father.
Any cancer?
No.
Thyroid disease?
No.
Blood disorders?
Not that I'm aware of.
Obesity?
No.
Visual or hearing problems?
Everyone in my family wears glasses.
Any genetic or congenital diseases such as birth defects?
Not that I'm aware of.
Any emotional or mental health concerns?
No.
Any learning disabilities?
No.
Behavioral concerns?
No.
Drug or alcohol abuse?
No.
You spoke that your father was deceased. Any of your grandparents or any other immediate family members?
My father's parents are deceased.
Okay. Do you know their cause of death?
I don't recall.
Are you concerned about any illnesses of a family nature?
No.
Do you feel safe in your home?
I do.
And who do you live with?
My wife.
What do you do for a living?
I'm a utilities worker.
Do you what past jobs have you had?
I used to drive a truck.
Have you ever had to change jobs because of a health concern, hazard, or exposure to violence?
No.
Do you feel as though your family has the resources they need, for example, like financial resources, health insurance for primary and inpatient care?
Yes.
And what is your highest level of education?
Community college.
An associate's degree?
Yes.
Do you currently or have you ever used alcohol?
Yes.
How often?
A couple times a week.
Okay. And what do you drink?
Beer, mostly.
Okay. And how many beers do you usually have a day?
Oh, just a couple. If I'm drinking.
2 or 3 or?
Sure.
Okay. Tobacco?
No, not anymore.
You used to?
Used to.
How long ago was that?
Probably good, close to 10 years now.
Was it cigarettes?
Yes.
And how many years did you smoke?
Probably 10 years.
Any caffeine containing beverages?
On occasion.
Okay. Any recreational drug use?
No.
Do you feel like you sleep well?
At times.
At times, okay. And how many hours of sleep do you get at night?
I try to get 8.
Okay. Do you exercise?
From time to time.
Okay. And what do you do for exercise?
Walk or jog.
Okay. In order to help me understand your diet, could you provide me with the foods that you've eaten in the last 24 hours?
I had a salad for lunch and a soda with it.
How about dinner?
Tacos.
Okay. Any fruits today?
Not today.
Okay. And did you drink any water?
I do. I try to drink a couple glasses of water a day.
Do you feel as though you have stress in your life?
From time to time.
Okay. And what do you do to cope with those concerns?
I just try to relax.
What do you do to relax?
Hang out with friends. My wife.
Okay. Have you ever sought outside help for those concerns from a mental health professional or a pastor?
No.
Have you ever witnessed or been exposed to any emotional, physical, or violence abuse?
No.
Let's talk a little bit about safety in the home. Do you wear a seatbelt?
Yes.
Okay. Do you wear a bike helmet?
No.
Do you have functioning smoke and carbon monoxide detectors in your home?
Yes.
Okay. And a fire extinguisher?
Yes.
Okay. Are there any guns in the home?
No.
Okay. Have you had any current or past exposures to health hazards such as crime, violence, pollution, secondhand smoke, let or rain on your home, at work, or in the community?
No.
Okay. Do you have any specific religion affiliation?
No.
Is there anything related to your health that would affect healthcare?
No.
Okay, let's just kind of review the symptoms. Lately, have you had any fevers, chills, fatigue, night sweats, or weight changes?
Fatigue.
Fatigue. And what makes that worse or better?
Moving around. Getting up.
Have you had any pain today?
No.
Is there any change in your skin, such as your moles or your nails?
No.
Do you wear sunscreen?
If I need to.
Okay, if you're out in the sun.
Mm-hmm.
Okay. Any condition or changes to your scalp or distribution of hair?
No.
Do you wear eyeglasses or contacts?
Yes.
Okay. When was your last eye exam?
A couple months ago. Probably
Okay.
3 months ago.
And you follow up yearly?
I try to.
Do you have any glaucoma or cataracts?
No.
Any hearing loss, discharge, or hearing loss or discharge notice from your ears?
No.
Okay. Any ringing in your ears or dizziness?
No.
Any hearing aids?
Nope.
Okay. Have you had any recent colds, runny nose, sinus pain, infections, or nosebleeds?
No.
Okay. Any missing teeth or dental problems?
No.
When was your last dental exam?
Probably 2 years ago.
And how often do you brush and floss your teeth?
At least once a day.
Both?
Try to.
Okay. Any stiffness, swelling, lumps, or tenderness in your neck?
No.
Have you noticed any lumps or soreness or discharge from your nipples?
No.
Have you been feeling short of breath, experienced any wheezing, cough, or sputum recently?
I'm short of breath from time to time.
Do you have a history of asthma?
I do.
Any acute exacerbations lately?
No.
Have you ever had chest pain, hypertension, high blood pressure, heart murmurs, or elevated cholesterol?
No.
Okay. Have you experienced any diarrhea, constipation, or change in your bowel habits, or straining to have a bowel movement?
No.
Any nausea or vomiting?
No.
Any abdominal pain?
No.
Food intolerances?
No.
Any rectal bleeding?
No.
And any swelling of the glands in your groin area?
No.
Okay. Do you experience urinary frequency or blood in your urine?
No.
Any incontinence or flank pain?
No.
Any sexually transmitted diseases or urinary tract infection from your penis?
No.
Okay. Are you circumcised?
Yes.
Do you have any children?
No.
Are there any fertility desires or concerns that you have at this time?
No.
Have you ever had a prostate exam?
No.
Okay. Are you sexually active with men, women, or both?
Women.
Okay. And how many lifelong partners have you had?
1.
And how many current partners do you have?
1.
Do you use any form of contraceptives?
No.
Do you have any limitations in your range of motion, swelling, or weakness of your joints?
No.
Any history of head injury? Can you elaborate?
I fell and bumped my head a couple of years ago.
Okay. Any repercussions from that?
No.
Okay. Did you lose consciousness?
From what I can remember, yes.
Okay. And is that the only instance that you've ever lost consciousness?
Yes.
Okay. Do you have any numbness, tingling, seizures, tremors, headaches, memory impairment, irritability, or mood swings?
No.
Okay. Have you ever been anemic or had a low blood count?
Not that I know.
Okay. Do you have a tendency to bleed a lot?
No.
Any thyroid problems or unusual sensitivity to hot or cold environments?
No.
Any excess hunger, thirst, or urination?
No.
How would you describe your overall mood?
Content.
Okay. Do you have any history of anxiety, panic attacks, depression, mood swings, hallucinations? Any suicide attempts or ideations?
No.
And any eating disorders needing treatment?
No.
Is there anything else about your health history that you were concerned about?
No.
Okay. Well, this concludes my health examination. It was a pleasure meeting with you, and I thank you for your time.